Hello everyone. Today is the first case study online video from the ultrasound education group, University of Melbourne. And my name is Khoa. This is Lindsay, the ultrasound education group director.
Thanks, Clive.
So today, Lindsay, would you mind introduce to our student the first case study?
Sure. So this is actually about a young woman who wasn't speaking any English at all, who came to the emergency department with what seemed to be gastro-like symptoms. So she had tummy pain, she was very, very unwell, but she was also had very, very low blood pressure. And as part of her assessment, we did an abdominal ultrasound to see if we could figure out what the causes might have been. By the way, she said that there was no way she could possibly be pregnant. In this first view, we're looking through the right upper quadrant, and you can just see there's a little tiny bit of fluid up there between the kidney, the right kidney, and the tip of the liver, and that's often the very first place that you might see this. So that might be normal for her, but it was suggestive that it might have actually been bleeding from what we thought might have actually been an ectopic pregnancy. And as we continue, you can see that's a little bit easier when it's mobile. That's the left upper quadrant, and all around the spleen here is quite a lot of black, which suggests that there's free fluid, again, most likely bleeding in this situation. Then we had a look down in her pelvis, and that's a trans view. And as we go through the uterus here, we can see that there's actually not a pregnancy in the uterus. And off to the right-hand side, sort of roughly heading towards where her ovaries should be, there was something else that looked like it might have actually been a little pregnancy sac outside of the uterus. And you can just see it there on that view. This is a long axis view showing that the actual uterus itself didn't have any pregnancy in it. And down here behind the uterus is a big grey area which doesn't look like bowel, and that's actually clotted blood. So this woman is, although denying she's pregnant, strongly suggestive that she might actually be pregnant and actually has a pregnancy outside the uterus, and she's probably got a lot of clotted blood throughout her abdomen. And that's just a bit of a zoom view of this sort of mass beside the uterus with a very prominent blood vessel going into it, which suggests that this is actively still bleeding whilst we're actually examining this woman. And she now needs to go to a centre where she can have this dealt with as an operation. So the finding of free fluid in a woman who's pregnant, and we confirmed that she was pregnant with a blood test, means that she's most likely going to need an operation. She didn't get any more formal ultrasounds. She went straight to theatre. There was about 1.5 litres of blood in her abdomen, and she had a good outcome. This was all happening after midnight, by the way. So the lead into as to why we would think this is an important skill to have is that you can actually help diagnose, risk stratify, speed up the speed of diagnosis, and even improve safety and outcomes. This type of skill is taught on our postgraduate certificate courses. It's taught in an approach to unstable patients in a part of the course called peri-arrest, and it's also taught in our pregnancy section in the first trimester, where we're looking at problems of first trimester pregnancies of women that come to acute care and emergency departments.
Oh, thank you, Lindsay. So that's the first video for today. If you have any question or suggestion, please comment below in our YouTube. And at the end of this video, there will be a link to our website so that you can study more ultrasound with a lot of our online course and hand-on workshop. Thank you and goodbye.
Thanks very much.
A couple